Dr. Louisa here. It's World Oral Health Awareness Month, and World Oral Health Day is on the 20th of March. Can you please tell us your name?
Gloria. I'm Madam Hannah here.
Gloria, you know this month is Oral Health Awareness Month.
Actually, I didn't know.
When you said this month, the Oral Health Awareness Month. We are sure.
Really?
It's the World Oral Health Day, Nedabing.
Is
that true? I said no.
20th.
You got him? If you investigate this very well.
First of all, show me your canine.
Hey, what a surprise.
Okay, show me your canine.
I think the long one, I don't know whether I can see it well, but the long one after the front.
Yes, that's actually correct. You're saying that chairman with the canine. Okay. Your canine.
Be careful, huh?
Yes, the ones that look like vampire teeth, the pointed ones, those are your canines. So those teeth are used for tearing our foods. The incisors are used for biting, cutting, and then our molars at the back are used for grinding. Dr. Louisa here. It's World Oral Health Awareness Month, and World Oral Health Day is on the 20th of March. Can you please tell us your name?
Gloria. I'm Madam Hannah here.
Gloria, you know this month is Oral Health Awareness Month.
Actually, I didn't know.
When you said this month, the Oral Health Awareness Month. We are sure.
Really?
It's the World Oral Health Day, Nedabing.
Is that true? I said no.
20th.
You got him? If you investigate this very well.
First of all, show me your canine.
Hey, what a surprise.
Okay, show me your canine.
I think the long one, I don't know whether I can see it well, but the long one after the front.
Yes, that's actually correct. You're saying that chairman with the canine. Okay. Your canine.
Be careful, huh?
Yes, the ones that look
so
like
you're still watching Prime Morning, and we are back on your screens. Thank you so much for always making us #1 in your homes. And this morning, I'm excited. You can see like I'm smiling, beaming with smiles confidently, because I know that I've done a very good job with my teeth. And so meeting my very good friend, Dr. Louisa er3ctile, I feel very, very, very confident. You know, like when I say, I'm not shy. I don't know if you can do the same thing like I'm doing this morning. I'm here with the one and only Dr. Louisa er3ctile, darling.
Hi.
How are you?
Thank you.
It's good to have you here.
Thank you. I'm happy I'm here, and I'm so excited because I can see you have a bright smile.
Yeah.
You have a happy mouth.
And also, I have a gentleman here, and I bet you if Louisa is my friend, and she's not even my friend, she's my sister. If she doesn't say it, this man will check me because he doesn't know me. Like, you know, he doesn't chili nonsense. I'm talking about Dr. Ohene Mafu, who is with the University of Ghana Dental School. Good morning, Doc.
Good morning.
How are you?
Fine, by God's grace. I hope you're doing well.
I'm doing fantastic, I must say. You know, and go good, right? And it's all about World Oral Health. Is a month that we are celebrating, right? Or
Yes. But today is the day itself, yes.
So
but
we're celebrating today, but the whole month it is.
Yes.
Because I'm seeing the videos that you are doing, and, you know, people don't know which one is the canine. All we know is that my wisdom tooth, and then my, you know, my gum and my teeth. That is it.
Sadly so, but we're trying to change that. We're trying to do more oral health education. That's why we're here. You see us all over the place. We're trying to change that narrative so that each Ghanaian will be equipped with the knowledge that they need to have about oral health.
So this year's theme is a happy mouth, a happy mind.
Yes.
Oh my goodness. A happy, it resonates with a lot of people, you know, because when you go to bed, you wake up and you don't know if your mouth smells good or not. So sometimes you are very, very uncomfortable. You are not confident about it. Now, let's explain what the theme means today to everybody.
Okay, so I think we'll both share what we think because it's pretty subjective. What a happy mouth and a happy mind means to you. A happy mouth, I think it's a bit of a metaphorical, you know, wordplay that they did there, happy mouth, a happy mind, because a happy mouth means that you're, looking at your smile, it even makes you happy. You're confident in your smile. You're confident you have good breath. You're confident that people are not going to, judge you when you speak. And so that also reflects in a happy mind. Because when you have, you're comfortable with your mouth and you're comfortable with the smile, the way you look, your general confidence in yourself is going to be way better, and then, that's going to give you a happy mind. And, there's a relationship. It's like a two-way relationship. A happy mouth giving you a happy mind, and a happy mind also giving you
Very true. You have no idea how it can affect your mind. You're going around, you're like, my mouth smelling.
Yes, yes.
Oh.
And even the other way around, which most people do not even know about, is how your mental health can even affect your oral health. Things like anxiety. There's something called bruxism, where people clench and grind their teeth when they are anxious. So having mental stress can affect your oral health in that way, because you're grinding your teeth and you're going to have tooth wear, you're going to have pain in the joint here called the TMJ, temporomandibular joint, so you're going to have pain there. This is a way that your mental health is affecting your oral health without you even knowing. People that are on antidepressants, there are some medications that are used to treat mental health diseases. They tend to cause dry mouth, and dry mouth leads to so many things, bad breath and all of this, because your saliva has a very important role in your mouth. So these are things that we should know. If somebody is on any antidepressants and they're having issues with saliva flow, bad breath, then now it makes sense. You need to go to your dentist and your doctor, either your psychiatrist or your psychologist would have to come to an agreement on what to do to curb those side effects, And overall, your self-esteem. If your self-esteem is low, you are anxious about maybe having a missing tooth or the improper alignment of your teeth, all of these can affect you in either way. So it's a two-way street, and either way, it's very important for us to know.
How come I never thought about it? Because, sometimes people don't have the correct arrangement of teeth, and we are always teasing them. Society doesn't even make them feel comfortable. We call them all sort of names, zipper glass and all of that. And it's affecting their mental health.
Yes. So that's the oral health influence on the mental health. Like the silver glass you said. I mean, we are in school, my teeth are not arranged well, and they start laughing at me. It means it brings my confidence down. I wouldn't really want to come out. I wouldn't want to talk. And social isolation. When people are going, I wouldn't want to join the crowd because I feel I'm not pretty, or because my teeth are not arranged well. Also, when you have pain, when you have a toothache, definitely the pain is going to cause discomfort. The patient the individual cannot think well. Assuming it's a student, that student cannot really study. You have exam and you really have a bad toothache, and so you can't really focus on your studies. So that's where oral health actually comes into the mental health. Low self-esteem, your confidence goes down, the pain and the discomfort, and it's stress. If you can't sleep at night, for some people, they have pain that disturbs their sleep, and for days, they can't sleep. So you can see the stress affecting them. Last year, we did a happy mouth, a happy body. So we were focusing on how oral health affects the body, and these are some of the things we could see, maybe causing kidney diseases or other diseases. But this time, we are talking about oral health and mental health. We want the world to know, we want Ghanaians to know that oral health isn't something that maybe they all know is just the mouth and the teeth, the teeth and the tongue. No, it goes beyond that.
Wow. I bet most people didn't know this. And this is a good education. I'm very excited for this theme because, trust me, we walk around and we all fall victims of it. We haven't treated people well because of their dental condition without taking into consideration their mental health.
Yes, and another thing here, especially in my field of dentistry, which is orthodontics, most of the time when people report early, so if you notice that the arrangement of your child's teeth is not too good, reporting early when they are younger, most of the time we have some interceptive procedures that we can do.
Really? At what age?
So as soon as all the adult teeth start coming in. So from ideally, when your child's first tooth comes in, by the child's first birthday, they should have gone to see a dentist. By their first birthday. So building a dental home is something that we really advocate for, so that there's a relationship between your dentist and then the parents. If there's anything that needs to be corrected, it is done early. things like tongue tie. Some children are born and then the tongue is we call it a tongue tie, is not really mobile in the mouth. So it affects speech. So if something like this is seen early, then a surgical procedure can be done to free the tongue and then the child will now speak well. But if you're not going to see your dentist, this problem cannot even be diagnosed for treatment to be done. And so you are here going for all sorts of other spiritual stuff and all. But it was something as simple as a tongue tie. That's why we say that by the child's first birthday, establish that relationship with the dentist where you start going to see the dentist.
Even though the child doesn't have any teeth showing, you still have to go to the
by
dentist.
The first birthday, they would have
there'll be like 2B showing.
At least by 6 months, you'd see
the first two.
The first two come in. Now it can even go to 4 months. I mean, things are changing. Averagely in 6 months. So as soon as you see the first tooth in the mouth, that is when you have to.
At that point, if the child should have some sort of misarrangement, it can be fixed.
It can be fixed and it would be cheaper for you. It would be easier.
Yes.
Yes, because if you're waiting till all the adult teeth have come in, you may have to put the child in braces, which would be a bit more expensive. But if you are coming earlier and then we'll do something like a removable appliance to sort of arrange the teeth properly at that early age, it's going to be much cheaper for you and it's going to be much easier on the child as well. They don't have to go through bullying and teasing at school.
Trust me, most people didn't know this because I know somebody whose child is struggling with this. But the person says, oh, they told me to wait till my child is about 12 years before we can fix it. So the child is like 7 years or something and the teeth is really, really bad. But the child will have to go through till 12. And I keep on saying, why till that age? Can't anything be done?
So like Louisa said, that's her field. Something can be done about it. So I would say that, I mean, when you come to University of Ghana Dental School, when you go to KNUST, I mean, the dental school in Kumasi, they have orthodontists and several private facilities in Ghana. You'd have to see the orthodontist. So in dentistry, we have subspecialties. I'm a dental public health specialist. She's orthodontist. We have the maxillofacial surgeon. So there are subspecialties. So if you meet a general dentist, and maybe the person would ask you to see an orthodontist. So an orthodontist would be the best person to look at it and tell you what to do. Besides, I always say that if nothing can be done about it, even at that time, the orthodontist can advise you when some things can be done and you plan towards it. That one, it's way better than not knowing anything about it and sitting home. Because even if the child knows that, let's say she is 7 and it will be 12 years that the child will even have this done, in the mind of this child, she knows that after 12, on my 12th birthday, things are going to change. So there is a little bit of hope for that person. It's way better than not having that hope and you don't know what's going to happen and they still keep laughing at you, or you don't really believe in yourself because of your looks.
Wow. Louisa, what's the most common oral health issues in Ghana?
So tooth decay is one of them. We were laughing about this the last time, that when you go somewhere and people find out you're a dentist, you see at a party someone is showing you their back. It shouldn't be that way. That's why we're advocating for everyone to go to see their dentist at least twice in a year. Whether you're in pain or not, whether you have a problem or not. So tooth decay is one of them. Gum issues, so periodontal diseases is another. People feel like, oh, when I brush my teeth, I always bleed. It's not normal for you to bleed when you brush. Bleeding gums is not normal. It's like saying that every time I take a shower, my skin bleeds. It's not normal, so we shouldn't see that as normal. So bleeding gums, periodontal diseases, all of these are also very common. We also have oral cancers, which a lot of people do not know about. Those are also, we see them a lot in the government institutions because that is where they would usually come to. And then also bad breath. Is something that a lot of people battle with. So these are things that we want to educate people about. If you're facing any challenges with any of these conditions, please see a dentist. The earlier you go, the better. Because most of the time, these conditions, when diagnosed early and treated early, is going to be much cheaper. And it's going to take you through less stress. Because imagine that you have a cavity and you go to a dentist, you get a filling done. You pay for that and you're good to go. But if you wait and then the cavity spreads all the way into the pulp, which is the part of your tooth that has the blood vessels and the nerves, you're going to have excruciating pain. And that's going to take you through a lot of stress. personally, you're also going to have to pay more money for the treatment that will be done at that stage than you would have paid for if you had gone when it was just a hole in your tooth that wasn't hurting. So that's also another thing that we want to bring people's minds to. And, you know, the fact that these things they are preventable. So if you don't prevent it and it even happens, the earlier you seek treatment, the better for you.
Wow. Today's conversation, I wish I had like 2 hours for this because I'm enjoying it so much. You know, there are so many things. There are misconceptions about oral health as well.
Yes.
Tell us some of them.
Great. So first of all, dentist is not all about tooth extraction.
Okay.
You know, in Ghana, as soon as you say you are going to see the dentist, the first thing that comes to mind is I'm going to remove my tooth.
Yeah.
Or they are going to take out my tooth. No. We've passed that stage years, long ago. Dentistry is not all about extraction. Oral health goes beyond even the teeth and the tongue as well as the gum. So it is because people present stage late. I mean, they don't come in at an early stage. That's how come you may not have any other option than to extract. And it might also be expensive at that late stage to keep the tooth. So most people will now go in for extraction. So we go beyond that. Like Dr. Louise's team, they do the arrangement of the teeth wall. It's not necessarily extracting the tooth. Then again, some people will say that when they extracted one tooth, it affected the other. No. What caused that tooth to be carious? That same condition didn't change. So then the other tooth or the other teeth in the mouth are also experiencing the same thing. I mean, I'm not brushing twice a day. I'm taking all the sugary food I'm supposed to take. I'm doing all the negative things. So one, they've extracted one because of a cavity. The other teeth are not spared. So the conditions never changed. But then outside, they assume when you take out one, the other one too, it will happen to the other one, like it will be spreading. Extraction doesn't cause spread. It rather stops the spread.
Okay.
Then again, when people are pregnant, they assume that after every pregnancy, they should lose a tooth. Yes. So they'll say that, yes, they'll tell you that some hot air or
hot water or
passed
something,
through their mouth after delivery, and because of that, they lost a tooth. No. It is because pregnancy has induced, or should I use the word precipitated, a periodontal condition that has caused the tooth to be loose and it fell off. I told you the tooth was in a bone covered by a gum.
Right.
That's the periodontium. The periodontium is the supportive structure of the tooth. So once it is defective, the tooth cannot stand on its own. Okay. So then it happens and everybody will be saying, oh, as soon as I give birth, I lose a tooth. No. Another misconception is how hard people brush. I mean, when they are brushing, you can hear them from Accra and if you're in Kumasi. It's not how hard you brush. It is not how hard the brush is, the bristle of the brushes, that will make your teeth white, no. But it's the technique and the frequency. It's the technique and the frequency. So you should use a soft or medium bristle toothbrush. Okay. Soft or medium bristle toothbrush. Your toothpaste should contain fluoride. Okay. And you should brush one in the morning.
It should contain fluoride?
Fluoride, okay. Yes. So fluoride has to be in the toothpaste. Okay. I know people are talking about toothpaste that doesn't contain fluoride. I mean, no. We dentists, we are telling you today that your toothpaste should contain fluoride. Why so? So fluoride will prevent cavities from forming. Oh, right. Fluoride will strengthen your teeth. Okay. So apart from strengthening your teeth, it prevents cavities from forming. And sometimes when the cavity starts, sometimes the fluoride can help stop it.
Okay.
Yes.
Okay. Wow.
So as I said, soft or medium bristle toothbrush.
Not extra hard.
No.
Not even hard.
Not even hard.
Not even hard to even move to extra. Okay. Soft or medium.
All right.
Then again, you would have to brush in the evenings too.
Okay.
And when you brush
so it's not just morning?
No.
All right.
You know, sometimes when I brush in the evening, maybe I really want to eat, I go and eat. But you see, after that food, you have to brush again. Because what we are supposed to do is we are preventing food substances that stays in the mouth for that 10 hours, 8 hours sleep. Because that 10 or 8 hours sleep, you have in your mouth, you have bacteria. I have bacteria, Lisa has bacteria. Beautiful you have bacteria in your mouth. And now this bacteria acts on the food substrate. Okay. You know, we have an end product of everything. So the end product of the bacteria feeding on the food substrate is production of acid. Okay. So assuming you ate at 9 p.m., the bacteria did whatever you want to do at 12, the next brushing is going to be at 8 a.m. or 7 a.m. The acid has over 7 hours to stay on your gum, on your tooth. Okay. And that is where the cavity starts from. Oh. Because the duration of the acid in the mouth is what is going to lead to the dissolving of the enamel to cause the cavity.
So what's the right way to brush your teeth?
Great. So should I take it all?
Yeah, you can have it.
Great. So we advise, there are various techniques of brushing, but today we will advise people to brush in circles.
Okay.
First of all, it should be a medium or soft bristled brush.
Okay.
Your toothpaste should contain fluoride. Then you have, it can be a pea size of toothpaste.
Okay. Can be a pea size?
Yes. So you see, people can also, I mean,
Hey,
it's not... It's
I'm learning a lot, too.
Yes.
Because I have to make sure that it is on its plate. For M to N. So it's just a pea size.
Yes.
You're okay.
So as I said, it's the technique and the frequency.
Okay.
Great. So yes, if you look at your mouth very well, you realize that, let me use this word, semicircular in shape. The gum, they are semicircular in shape. So once you brush in circles, it's like you are going the way of the gum.
Okay.
You are following the contour, the patterns of the gum, so you don't end up harming your gum. Now, some people brush this way. When you brush this way, you are not really following the pattern of the gum. So eventually, your gum can move away from your tooth.
Oh.
Yes. And when you also use hard brush, it can also cause your gum to move away.
How does your gum move away from your tooth?
So because something gingival recession, I don't want to be using the term. I don't want to be using the term here. That's why I'm using the word moves away. So gingival recession means the gum recedes.
Oh, with time it does?
Yes.
Okay.
If the gum doesn't recede, because something cervical abrasion, it means that the part of the tooth or the teeth that meets the gum will start wearing off. Because of the hard brush or how you brush.
Okay.
So once you use the soft or medium bristle brush and you brush in circular motions, following the patterns of the gum, you do the same thing for the down. So, I mean, I'm doing the same thing at the same time. When I'm done, I open my mouth, and you realize that there are also parts of the teeth that are inside your mouth. So for the posterior part, I mean, I have to raise my tongue. Forgive me for doing my tongue.
Oh, that's okay.
No human being can do this. So you also try to brush in circular motions for the inside teeth, the big ones.
Right.
The same on this side, and you repeat the same thing at the upper part. But the front teeth will be difficult to do the circular motion. So what we say is you sweep away. So I go to the gum and I sweep out for the lower teeth. So I do it like this. For the upper teeth too, I hit the gum, then I sweep out. So circular motions outside, circular motions inside for the posterior teeth. For the anterior teeth inside, sweep out, sweep out. You sweep out and you sweep out. Then you don't forget where you chew. The chewing surfaces, you can do your scrubbing there. If you want to use all your strength, you just do it on the chewing surfaces.
Okay.
That is where the food particles normally can get stuck. So you do the scrubbing on the chewing surfaces. Then you're almost through, but you're not done. Don't leave out your tongue.
Oh, right.
And there is a 30% part of your tooth that your brush cannot clean.
Okay.
That is in between your teeth. That's where you have to floss.
Oh, that's where the floss comes in.
That's where the floss comes
So
in.
do you have to floss every morning?
Yeah, so we usually say after every meal, because that's
meal?
when you eat and then the food can get stuck. So after you eat, you can get... Now we have the thread-like
My producer,
one.
Martin, did you see him, the gentleman there? Well, he says he doesn't know what floss is.
Okay. So floss is like a thread-like material. So now we have some on the plastic, the handheld ones, where it makes it very easy. You just hold it, and then you put it between the two surfaces and then clean it out. The thread-like one is just like a piece of thread. You can get it in any pharmacy, any supermarket, dental floss. So when you take a piece, you just wrap it around your finger, wrap it around this finger. You go between the tooth surfaces. You move towards one side of the tooth, bring it out, go in again towards the other side and bring it out. Some people floss till they start bleeding. That is not the correct way.
No.
You must be very gentle like what is shown on the screen. You just go between and then you push it down, and then whatever food debris is stuck there or plaque that is stuck there will come out, and you'll be amazed.
Can you do it with toothpick?
No, that's dangerous. So, you see, the reason why we are saying a big no to toothpick or broom or needle or any sharp, no, you hurt your gum.
Oh.
Yes, you hurt your gum.
And the toothpick, the edges or the tip of the toothpick can actually get broken and get stuck in there. And you may not know that happened. So over time, you have a swelling there. You don't know what happened. You're rinsing with warm salt water and all of that, but it's still there. And most of the time when they come in and then we see them and then we irrigate the place and go in there, you find a little tiny piece of toothpick tip that is stuck there. So you could avoid that by just simply using your dental floss. Yes.
I think you made a statement somewhere, and I saw it about gum diseases or gum infection affecting your erectile function.
Dysfunction, yes. This is another interesting topic that goes wild on social media when we say it, because people think that we're just scaring them. No, but then some of these gum diseases, they are caused by bacteria and causes inflammation. And this is not me saying it. This is not Dr. Marfo saying it. It is backed by research.
Yes.
That there is a link between gum disease and erectile dysfunction in men. This is not us saying it, is backed by research. And this is because of the inflammatory processes that are involved in there. So that is why we want you to stop it where it starts. Stop the gum disease where it starts.
So
Go and see your dentist.
when you get the gum disease, the bacteria now goes in there
It's
to
traveling. Every part of your body is connected. Our blood vessels that run up and down, they are not there for no reason. They are connecting every part of our body. And so they can travel all the way.
Oh, yes.
Yes.
It didn't affect your... It came all the way.
It's not only erectile
only that.
dysfunction, heart disease.
Yes.
All of these have been backed by research. It's shown by research that gum disease has a connection with all of these other systemic diseases. Yes.
Wow. Dear gentlemen, brush your teeth. Brush your teeth so you don't end up in church. Because that's the next
And
thing.
go and see your dentist. If you're experiencing any of these, your teeth are mobile, you're having bleeding gums, all of these things, they are red flags. You need to see your dentist. And as little as 1 to 2 visits, these problems can be solved. And then you save yourself so many other bigger problems that, you would find yourself in different places.
Right. And now talking about that, some people like to chew ice. Is it advisable to chew ice?
No.
Not advisable. So what foods are best to eat and what are not best to be eating?
Okay, so as your GP would say, your fruits and vegetables, there are some foods that are naturally cleansing foods. So something like an apple. Picture yourself chewing an apple with the crunch and everything. It naturally even cleanses your teeth.
Oh, wow.
Water is also another important part of our diet that we should not forget, because it's the water itself is cleansing in its action, and it's good for your body as well as your teeth. It's bathing your teeth in the moisture that it needs. So our fruits and vegetables, the ones that are crunchy, fibrous foods, they are usually self-cleansing for our teeth, and then our water as well. And basically just a balanced diet. Stay away from sugary foods. The processed sugars, so our cakes, our candies, we know we love them. But as much as possible, if you can stay away from them, or if you have to eat them with your main meal.
Yes. Okay.
Most of us do snacking. Sometimes all of us are guilty, but what happens is that every time you eat, your teeth goes through a demineralization and then a remineralization process. So if I have breakfast at 7 a.m. and my teeth has gone through that process, it's gone through the demineralization and then the remineralization at 7. And then 9 o'clock, I'm passing by and I see someone eating chocolate and I take a piece. My teeth have had to go through that same process again. 11 o'clock, I say maybe it's tea time. I go and have my tea. I'm going through that process again. Then I have my lunch. And then I want to have a snack, or I want to have dessert with that. I don't eat it with my lunch and I wait maybe another 2 hours. My teeth have to go through that process again. So you're just putting your teeth through so much stress. Yes. So if you have to have a snack, if you have to have dessert, eat it with your meal so that your teeth go through that process at one time, and then you don't have to keep going through the process several times in a day. Another thing also is brushing after meals. Most of us brush immediately after our meals because we say, oh, I'm trying to, get rid of anything that's stuck between my teeth or any bad breath. But you should wait 30 minutes after your meal before you brush. Again, because of the same reason, the demineralization and remineralization. You don't want to brush your teeth in its most vulnerable state, which is right after you've eaten. So ideally, you should wait 30 minutes after your meal before you brush.
So still on the food you are not supposed to eat or you are supposed to eat. Yeah. So even with the same sugar, like she said, the frequency, the duration, the type. For instance, I eat fufu. Somebody eats pizza. Pizza might be sticky. Fufu, I just swallow it. They all contain sugar, in terms of starch. Yeah. But then for fufu, because I'm swallowing it, it may not get stuck on the teeth. Yeah. But for the pizza, it might get stuck on the teeth. So it's even the type of food that you are eating. We are not here to say you shouldn't eat your food. We are not here to even say you shouldn't take the sweets you want to take. But we are just telling you the frequency and even how you do it. For instance, like she said, maybe with the main meal, so that your tooth doesn't have to go through the whole cycle again, demineralization, remineralization, and all those bits. So you can do all you want to do in a minimal way, but the right things are supposed to be done so that you don't end up having cavities, unless you want my pocket to be full.
I like that. So there's this hype of veneers, teeth whitening and all of that. Is it advisable, Louisa?
So all these are aesthetic, there's aesthetic parts of dentistry. Like he said, his field is the public dentistry, I'm orthodontics. There's another field called aesthetics. And I mean, we're all entitled to how we want to look. You know, in this day and age of social media, people want a Hollywood smile. They want to have a smile like what they see on TV.
Yes.
And you're entitled to that. Just make sure you go to the right person. Go to the specialists who are trained to do that, because there are so many people out there offering some of these services who are not trained to do that.
You don't do it?
We do that.
Not for you?
Yes, we do that at my practice.
Okay.
At Charisma Dental, we do all of those.
Yes.
And we have specialists that do that.
Okay.
So if it's done by a specialist, you're good to go.
Okay.
Example, I don't do that.
Oh, you don't?
I'm a dentist,
Okay.
but I don't do that.
Okay.
Because I'm not specialized in that field. So the point is, I can do it, but it won't be as I won't do the patient good like the one who has specialized in that field. So then at the end of the day, when I see a patient who needs veneer and all, I wouldn't want to attempt. I'd rather let the one who is right to do it so that it helps the patient. That's why Dr. Louisa is saying, and I'll stress on it, if you want it to be done, go to the right place, meet the right person, so you have a good job done. Else, it will come back with its own effect. With the whitening,
Is it advisable though?
So for some people, their teeth are diseased in a way that needs the whitening. But for majority of the people, it's for aesthetic reason. And that's where mental health comes in. You see why someone is sitting there and says that my teeth is not white, I want it to be white. There's a link because of how the person sees herself or himself, because of how the person sees his or her physique or appearance. That's a mental health effect, the way the person sees himself or herself. Now, if aside everything, one of the common complications of whitening is sensitivity. Because of the chemicals that we use in whitening. So if it must be done, please go to the right dental clinic. Right. Make sure the right oral health professional, a dentist, is seeing you. I mean, I've been honest here to tell you that as a dental public health, I wouldn't want to do veneer, and I'll let the right person do it. So if you don't get to the right dental clinic, you may worry yourself. Yeah.
Don't go and worry yourself. Anything we haven't said before you go?
So take advantage of the season we're in, because March is a month of oral health awareness. Most of the dental clinics are offering discounts. So if you are you're waiting to go to see the dentist because you are not, financially prepared, this is a good time. My clinic, for example, Charisma Dental, we're offering free consultation for this entire month.
Oh, wow.
And so many other clinics. The University of Ghana Dental School is offering free dental screening at the dental school car park.
Yes.
So this is an opportunity for you to go out there and then get your teeth checked in the month of March. And like we said, make sure at least twice in a year you see a dentist.
Yes. Very, very important. Thank you so much for being here. We are grateful. You said there's a dance for the thing?
There is.
There is a dance?
There is actually a dance challenge going on. And yesterday, Accra Boys, so Accra Boys are the originators or the creators of this dance challenge.
Okay.
And so it's going on social media. I've tried my best. I've done mine. I'm hoping I win. There's a Come On 14, a Techno Come On 40 up for grabs. There are 2 techno tablets up for grabs for the winners. So go on social media. You can go to my page, Dr. Louisa, on Instagram. You can go to the Accra Boys official page. You can go to the World Oral Health Day page, learn the dance, try your best and do it, and you could be the winner of the phone, the GDA online page.
All right.
We, members of the Ghana Dental Association, we also did our best, so we are hoping that we will be the ones to win. So the challenge is out there.
All right, so take advantage of the challenge. Thank you so much for being here. I told you the next concert I have to be there.
Yes.
You know that?
Yes, we know we are partners when it comes to concerts.
Exactly. So I'm going for the next one. I missed the one in London, but I'm not missing the next one.
Yes, ma'am.
So we'll be there, and of course, congratulations as well. And Louisa. Dr. Louisa is the brand ambassador for Oral Health Day. And I have had also Dr. Ohenimafo, who came in from the dental school at the University of Ghana. Thank you so much. And Muftau is on standby. Muftau, please, how many times a day do you brush your teeth?
Twice.
Twice.
Yeah.
Do you floss or use toothpick?
I used to toothpick.
Toothpick.
Toothpick. Me the toothpick. You want me to create holes in it?